MLT Case Study Series 18. Decoding HIV, a Medical Laboratory Technologist's Guide. A case study on diagnosing and managing HIV. Introduction. This case study delves into the critical role of medical laboratory technologists in diagnosing and managing HIV, illustrated through the diagnosis of a 29-year-old patient with HIV-1. Highlighting key diagnostic tests from screening to confirmatory assays, and the importance of CD4 T-cell counts and viral load in treatment planning, this guide aims to enhance technologists' understanding and impact on patient care in the context of HIV. Case Study, Patient X. Background information. Age, 29 years. Sex, female. Medical history, unremarkable. Presenting complaint, patient presents for routine health checkup. Expresses interest in comprehensive blood work due to recent engagement in unprotected sexual activity with a new partner. Laboratory tests ordered. HIV antibody/antigen, AG/AB, combo test. Confirmatory HIV-1/HIV-2 differentiation immunoassay. CD4 T-cell count. HIV viral load, HIV RNA PCR. Laboratory findings. HIV antibody/antigen, AG/AB, combo test, positive. HIV-1/HIV-2 differentiation immunoassay, HIV-1 positive. CD4 T-cell count, 350 cells/L. HIV viral load, 120,000 copies/ml. Diagnosis. Based on the laboratory findings, patient X is diagnosed with HIV-1 infection. The positive HIV antibody/antigen combo test suggests the presence of HIV antigens or antibodies, indicating exposure to the virus. The confirmatory HIV-1/HIV-2 differentiation immunoassay specifies the infection as HIV-1. The CD4 T-cell count and HIV viral load are essential for assessing the patient's immune status and viral burden, respectively. Detailed answer explanation. Understanding HIV testing and results. HIV antibody/antigen, AG/AB, combo test. This screening test looks for both HIV antigens, specifically P24 antigen, present shortly after infection, and antibodies, developed in response to infection. A positive result suggests HIV infection but requires confirmation. HIV-1/HIV-2 differentiation immunoassay. This test differentiates between HIV-1 and HIV-2 antibodies in the blood. HIV-1 is more prevalent worldwide and more aggressive compared to HIV-2, which is mostly found in West Africa. Importance of CD4 T-cell count and HIV viral load. CD4 T-cell count. CD4 cells are a type of white blood cell that plays a significant role in the immune system. HIV attacks and destroys these cells, weakening the immune system. A CD4 count below 500 cells/L indicates immune suppression, and below 200 cells/L is considered AIDS-defining. In this case, the patient's count of 350 cells/L suggests significant immune system impact. HIV viral load. This test measures the amount of HIV RNA in the blood and assesses the severity of the infection. A higher viral load is associated with faster progression to AIDS and an increased risk of transmission. The patient's viral load of 120,000 copies/ml is considered high, indicating active replication of the virus. Conclusion and next steps. The diagnosis of HIV-1 infection in patient X necessitates immediate medical intervention. The management plan includes antiretroviral therapy, ART, initiation, counseling on safe sex practices to prevent transmission, and regular monitoring of CD4 counts and viral load to assess treatment effectiveness and disease progression. This case highlights the importance of early detection and treatment of HIV to improve patient outcomes and reduce transmission. Medical laboratory technologists play a crucial role in the diagnosis and monitoring of HIV, emphasizing the need for precise testing and interpretation of results. Thank you. Please subscribe for more videos.